Okay, the best part of the evening. Estrogen and progesterone, our female hormones. Okay, they're produced by the ovary, both ovaries, and that's where they come from. Female hormone deficiency in young women starts early as 30 years, not when you are menopausal or 50 or so. Okay? They can start very, very early. Yes, goes to that, and then finally we look like that. We want to start treating somewhere here. Constipation, tired, constantly low mood, depressed, that's the estrogen deficiency. Headaches come during menstruation, whereas if it is progesterone deficiency, you get headaches before the menstruation. So very important to differentiate with your clinical signs or symptoms how you feel, whether it is estrogen or whether it is progesterone. She feels very nervous, irritable. So mostly progesterone works on your brain, whereas estrogen works on the body and reproductive system. Thinning of the hair, osteoporosis, you don't want to be getting there. Breast, estrogen deficiency, you'll have no breast tissue, but look at the progesterone deficiency, you get fluid retention in your breasts because it's a diuretic, it's supposed to get rid of the fluid. Okay? And this is how the breast should look. Look at the person with progesterone deficiency, how angry he is. Okay? Very angry. The wrinkles on top of the lips, upper lips, they are estrogen deficiency. What we call is smoker's lines. They're not actually smoke, they're estrogen deficiency. Okay. So, estrogen retains fluid, progesterone acts as a diuretic. So we need to balance that. Estrogen increases menstrual blood loss, but progesterone stops the blood loss. So if you come, you may have found yourself having heavy periods and you come, the doctor gives you Provera, which is a progesterone, to stop the bleeding. So progesterone, if you don't have enough progesterone, you will continue to bleed. Estrogen increases alertness, progesterone calms down the emotions and mood. Estrogen feminizes the body, progesterone helps to prepare the uterus for egg implantation and plays a vital role in pregnancy. So both these hormones has to be given together, not just one. Why do we lose estrogen and progesterone? One is aging. So we start here at 12 to 16, 400,000 of egg cells, and then we come down to this, 150, then 17, and then at menopause, 44 to 40, we hardly have any eggs left. We lose 600 eggs per menstrual cycle. Okay, 1 egg per hour. Tubal ligation, you lose estrogen female hormones as well, because if they clamp it around some of the arteries supplying the ovaries can be clamped and reduce the blood flow to the ovary, so you don't get enough estrogen. That's a syndrome called post-tubal ligation syndrome, PTLS. Pregnancy, this is how we look happy, alert and interested in before pregnancy, and this is a mother with estrogen deficiency. Okay. Look at that, no sleep. No sleep, no estrogen. Contraceptive pill, great hormone to prevent pregnancy, but we lose our hormones as well. Extreme physical activity. And other causes are growth hormone deficiency, underactive thyroid, and adrenal deficiency, and all that we talked about before. These are some of the things that we already talked about, which influence the female hormone production. And if we have estrogen and progesterone deficiency, we are susceptible to infertility, premature aging, bone density loss, cardiovascular disease, and dementia. Progesterone, a lot of us have got cysts in the breasts. That's progesterone deficiency. Breast cancer, ovarian cyst, endometriosis, endometrial hyperplasia. This is the thickening of the inside lining of the uterus. Endometrial cancer, uterine fibroids, infertility, pregnancy problems and miscarriages. You can take a test, and the lab test that we do the brain hormone, we do the estrogen level and the binding globulin and the progesterone. And that has to be done 7 days before your period in a premenopausal woman. Okay, so if you're getting your period, 7 days before. Now, in the premenopausal, this is a crowded slide. So premenopausal women, these are the ranges you look at, and if your range is between that, you are susceptible to these things: osteoporosis, lumbar spine, osteoporosis, cardiovascular disease. 81, if your estrogen level is less than 81, you are prone to low bone density. If it is below 60, cardiovascular problems. Okay? Between 100 and 110 is osteoporosis. That is in a woman who is still menstruating. But if you are postmenopausal, you have stopped your periods, if your levels are less than 50, cardiovascular complications, less than 38 levels, again cardiovascular complications, psychosis, so mental health issues and depression. Okay. So these are the optimum levels that we want in a woman who is menstruating. So if the levels are 2 to 13, we want 5. If it is between 100 and 12, we want 150. 41 to 79, we want 65 and 15, not on the lower range. And these are the hormones that we give. So for estradiol, transdermal on the skin every day in the morning, and progesterone you can also give orally, vaginally or on the skin before bedtime. For breast cysts, you can locally put this percentage on the breast. Now, when you get this gel, you don't just rub in one spot like that. What happens there is that it gets absorbed by the blood vessel straight away, so you peak your blood levels and off it goes, and then you don't get anything. You got to go all over the arm, big surface area, all over the arm, the shoulders, and rub it all over 10 times, not just rub and go. 10 times you rub it in. What you're doing by that is you opening up the cells that get allow the hormone to get into your subcutaneous layer, and then it slowly gets absorbed into your bloodstream and lasts longer. So the full surface. Okay. And with the progesterone, it's around the neck, the front of the chest, behind the ears. But a lot of times, not just one. Okay. And testosterone is in a thigh. And for the breasts, you just go on the lateral side of the breast, outer aspect of the breast on both sides. So these are some of the protocols we have, when to give and when to start in a lady who is menstruating or in a woman who is postmenopausal. Okay? So this is for me. How to naturally boost your female hormones? It's in your workbook, and I've given you some vitamins, some minerals, and the diet, fruits, vegetables, amino acid supplements, mainly protein, high intake protein, okay, and no sugars.